All right, I haven't done like a comprehensive where we are in the pandemic type update for some time, but it is time to do it. A lot of things have changed and there is much to discuss. So, to begin with, we're starting to see some really significant improvements taking place. Vaccines are being rolled out more significantly. I know about the variants. I know about the so-called mutant strains, and I will talk about them. I'm not ignoring them. I'm aware of them. I have the latest information as to how they will affect the vaccination program, if this or if that. So I'm not ignoring that. Just give me 5 minutes to get to it. I know that it's what a lot of folks have been focused in on, but let's dive right in. So first of all, cases, just the top line case number. Back in December, I predicted cases would peak permanently around January 10th to 15th. Now, how did I do this? Am I an epidemiologist? No. Am I a public health expert? No. Was I special in predicting this? No. Do I want a pat on the back? Yes, but not for this. A combination of experts were pointing out that given the winter peak and vaccines being rolled out and the holiday effect, we were likely to see a peak sometime around the middle of January. And case in point, that's a pun. The peak for the 7-day case average came on January 11th, when the United States hit an average of 255,000 cases per day. Since then, the number of cases has dropped by more than 40% to a 7-day case average of 147,000 cases. So the bad news is 147,000 new cases a day is insane. It's tragic. It's a disaster. Being down close to 50% in new cases per day in just a 3-week period, that is absolutely fantastic. And I expect that by the end of the week, we will be down that full 50%. Now, cases is one thing, but what about deaths? We also had reason to believe that the death peak would come 3 or 4 weeks after the case peak. Why did we have reason to believe that? Well, we know from the last year of this pandemic that deaths lag cases by 3 to 4 weeks. And indeed, the 7-day rolling average of deaths plateaued over the last 7 to 10 days, and hopefully will be on its way down soon. I had thought yesterday or today would be the peak. It turns out we've had sort of a plateau. Let's hope that those death numbers go down from here. Still, and I want to be clear that even as we see things improve, we don't want to forget that thousands of people have been dying in the United States every day. 4,000 down to 3,000 is still insane. It's still a 9/11 every single day. And there is a very long way to go. But the good news is that the numbers are doing what we thought they would in early December based on a lot of different factors, including vaccination. Let's now talk about that. Officially, the U.S. has seen about 27 million coronavirus cases. And the U.S. has now administered, not distributed, administered 33 million vaccine doses into the arms of folks. So we now have officially more doses than number of cases. That's a nice milestone. Now, if you remember my interview with Dr. Eric Topol a couple of weeks ago, our best guess right now is that the real number of cases, when you consider that many people never get tested because they're asymptomatic or they have mild symptoms and just never go and get a test, the real number of cases is believed to be somewhere between 2 and 3 times the official number. But still, it's a nice thing to be able to say we've now given doses. We've given significantly more doses than the number of total cases. As of right now, as of this morning, 8% of the U.S. population has received at least one dose. And about 2% of the U.S. population has received both doses. Remember, with the Pfizer vaccine, you have 21 days between dose 1 and 2. With the Moderna vaccine, you have 28 days between dose 1 and 2. You are not considered to be at maximum immunity potential. And remember, not everybody develops immunity, but close to 95% do. You're not considered to have completed the full course of vaccination and antibody generation until 7 to 14 days after your second dose. What we know is that these vaccines are working really well. Infections and hospitalizations are down among those first vaccinated. This includes healthcare workers, and nursing home residents. The two vaccines in play are Pfizer and Moderna. And although the rollout was a little bit slower than we would have hoped, they are accelerating dramatically. Pfizer going to bring in additional manufacturers. A lot is happening there. We also have a third vaccine and more. But most imminently, we have the Johnson & Johnson vaccine imminently to be submitted for approval. And within a couple of weeks after that, hopefully emergency use authorization. That's a one-shot vaccine. Now let's talk about the mutants, the variants. We have the UK variant, the Brazilian variant, and the South African variant. The concern being vaccines are or might be less effective against those variants. Some people already going as far as to say they won't work. The vaccination program is in vain. We're vaccinating against a strain that is not even the strain. No, okay, let's stop. Let's sort of break it down a little bit into its component parts, because much of what we are being told so far is not true. First of all, the rate at which these, I don't want to call them primary. Yeah, I guess we could call them primary variants or significant variants are mutating is exactly as expected for this type of virus. Nothing is happening that was not predictable in terms of these types of viruses and mutation. That's number one. Number two, as close as we can currently get to a reality-based assessment of the effectiveness of vaccines on the variants is as follows. The two vaccines currently in use, Pfizer and Moderna in the United States, appear to be essentially as effective against the UK variant and the Brazilian variant as they are against the sort of main strain as we might know it. It is true that the antibodies generated by these vaccines appear to be less effective against the South African variant. That doesn't mean that they don't still generate enough antibodies to be immune for most people against the South African variant. And what I mean by that is as follows. When you vaccinate people, they generate antibodies on a curve. And, you know, we talk about it's 95% effective. What we mean by that is 5% of people who get the vaccine don't generate enough antibodies for immunity. Now, you might still generate enough to avoid a hospitalization or a death, but 5% don't generate enough antibodies for immunity to the primary strain. But you have a curve, so you might have, just assign fake numbers to it, 95% of people generate at least a 100 level of antibodies. 90% generate at least 200 level of antibodies. 80% are at the 1,000 level, so on and so forth. While it appears to be true that the antibodies generated are less effective against the South African variant, it may still be effective enough for most people to be immune. Imagine that the antibodies generated are 1,000 level, and only 100 of them are effective against the South African variant. Well, if the threshold to be immune is only 95, then you're still okay. And I hope I'm being clear about that. So we still are gathering information about this. The idea that the vaccines don't work against the variants so far is not based in fact or science. It's not yet been demonstrated. And importantly, this is a race against the variants. The variants are a reason to vaccinate as quickly as possible, not to delay vaccination. Viruses mutate by spreading. The more people that vaccinate more quickly, we slow the spread of the variants and prevent more people from getting that variant, which may be less controlled by the vaccines we currently have. Moderna and Pfizer both working on a sort of modified booster in case it is necessary for some period down the road, could be 8 or 12 months from now, or maybe even longer. Now, as I said on the bonus show, I was on a wait list for leftover doses. A lot of hospitals and vaccination facilities are having issues where, because there's multiple doses in a vial, you might get to the end of the day and have leftover doses. And most hospitals have some kind of on-call list. I have a friend who works at a hospital. I said, put me on the list. I will give me 30 minutes notice and I will show up. We don't, she doesn't want any doses going to waste, and neither do I. I was able over the weekend to get the first dose of the Moderna vaccine. I had more arm pain being a lefty. I got it in my right arm, more arm pain than for any vaccine I've had in my life. I had a fever and flu-like symptoms for about 24, 30 hours. I spent Saturday in bed. I am now feeling fine, and I'm ready and waiting for my second dose in a few weeks. Now, one last thing I want to talk about. There are more and more articles being written expressing concern that these vaccines are being undersold. And they're being undersold when you hear cautious public health experts say things like, even after vaccinated, you still should social distance and wear masks and avoid indoor crowds and all of this different stuff. And I think it's important to understand that until we reach a level approaching herd immunity, we all still need to continue taking a number of the precautions that many of us have been taking. But we don't want to undersell the importance of the vaccine, because then you're going to see a lot of people say what they are saying now, which is, even if I get the vaccine, nothing changes. Well, then I'm just not going to get the vaccine. The truth is that these vaccines, particularly Pfizer and Moderna, are almost 100% effective at preventing death or even serious COVID. That is a huge game changer. While it has not yet been confirmed that the vaccinated individuals spread the disease to a significantly lesser degree, that's what would be expected, and that's usually how vaccines work. So I am a little worried about the degree to which the vaccines are undersold. As I said on the bonus show, and as I've spoken about with, public health officials and epidemiologists who are speaking not for the media, but just kind of between people, in 6 weeks, in 8 weeks, a group of 4 or 6 vaccinated people who work from home are able to be together with extremely low risk. It is not zero. Nothing is ever zero. But these vaccines are game changers, and we want to make sure we are not underselling them and we continue vaccinating as quickly as possible. I get people are being cautious, but if we start telling people, even with vaccination, you still have to social distance and wear masks indefinitely, a lot of people will say, well, I'm going to opt out, and we don't want that. Send me your thoughts. I am on Twitter at @dpakman. This is good news. Notice I didn't mention Trump or Biden in this entire segment. This is an analysis of the data and the science of what is going on. This is not a political statement, a political segment of any kind. Let me know your thoughts. I'm on Twitter at @dpakman. I want to take a second to tell you about one of our sponsors, S&H Masks. S&H Masks has everything you need when it comes to face masks and other protective gear for COVID-19, and they're giving my audience 20% off. S&H Masks is the company that I've personally been going to for face masks. I love and trust the products they sell, and that's actually why I reached out to them about being a sponsor. I've tried tons of different face masks this year, like many of you, and I still have not found a mask that is more comfortable or easier to breathe in than the washable cotton masks that they sell. It's made of a silky, lightweight cloth that feels great on the skin, has a convenient adjustable strap. They also have disposable cloth masks, which are really comfortable, as well as all of the other gear like face shields, alcohol wipes, no-touch infrared thermometers. And all of their prices are very reasonable. I also love S&H Masks because they've donated over 60,000 masks to healthcare institutions. They're an excellent company. Shipping is just $5, and shipping is free on orders over $150. You can get there by going to davidpakman.com/mask. The link is under this video, and you can save 20% on everything in their store when you use the coupon code DAVID.